So while the movements of dorsiflexion and plantar flexion occur at the talocrural joints, the movements of inversion and eversion occur further down the foot. Specifically, they occur between the talus and calcaneus and between the talus calcaneus forming the rear foot and the midfoot being formed by the navicular and cuboid. The calcaneus sits immediately beneath the talus. It's the largest bone in the foot, and it provides a site of attachment for some of the major muscles of the lower leg, and as well as acting as a lever for propulsion for the propulsive phase of the gait cycle. There are certain key palpable bony points to identify. Here on the medial side we've got the sustentaculum tali. Over here we have the peroneal tubercle, and on the underside we have the medial there and lateral tubercles there. On top of the talus, on the superior aspect of the talus, we have a number of articular facets. There's one posteriorly there and two anteriorly, and on the anterior surface of the talus we have a fourth articular facet, which is for articulation with the cuboid. The subtalar joint is the joint between the talus and the calcaneus. So here what we've got, on this side we've got the inferior aspect of the talus. So there's the head of the talus forming the convex surface. Underneath the head of the talus, on the plantar aspect of the head of the talus, we've got two small facets here. We've then got a big groove that goes across the underside of the neck of the talus, with a third facet sitting here posteriorly. Again, when we look onto the superior surface of the calcaneus, we can see corresponding facets. So there's a large facet over here with two smaller facets, one sitting on the top of the sustentaculum tali and one lying slightly anterior to that. When these articular surfaces come together, they form the subtalar joint, or the talocalcaneal joint, which is classified as a synovial modified multi-axial joint. It's got an oblique axis of movement that leads to a triplanar motion between the two bones. Purists will say that the posterior facet here are the ones that form the subtalar joint, although it's generally accepted that these two facets here and these two facets also contribute to the subtalar joint. So typical synovial joint. So therefore the articular surfaces are covered in hyaline cartilage, and all of the articular surfaces are surrounded by a loose capsule which is lined with synovial membrane. That does all the typical things that a synovial joint does, passing from articular margin to articular margin. In terms of stability of this joint, the primary stabilizing factor is a structure called the interosseous ligament, and the interosseous ligament passes from the groove on the underside of the talus to the groove on the top of the calcaneus, the sulcus tali through to the sulcus calcanei. So if we go back a slide, if we go back to the original picture here, the interosseous ligament is a series of laminar series of layers that pass from this groove here, the sulcus tali, down to this groove here, the sulcus calcanei, and it's a very, very tough ligament, very strong ligament indeed. It's found inside this hollow formed by the two sulci coming together, which is collectively called the sinus tarsi. Now, the interosseous ligament is the major stabilizer of the subtalar joint, and injuries of the interosseous ligament are very, very unusual. It's such a strong ligament, it's unlikely that you're going to get any major tears of this ligament. You're more likely to develop fractures of either the talus or the calcaneus. On the medial aspect, the subtalar joint here, we can see the subtalar joint here. So there's the talus sitting on top, there's the subtalar joint in here between the top of the calcaneus and the inferior aspect of the talus. On the medial aspect, it's reinforced by this structure here, which goes from the lateral tubercle, the medial tubercle on the talus across to the posterior part of the sustentaculum tali. That's called the medial talocalcaneal ligament. The function of this is to prevent excessive abduction of the subtalar joint. On the lateral side, we have two ligaments. We've got this small structure here called the cervical ligament. And the cervical ligament is quite a sensitive structure, forms the anterior border of this hole here, the sinus tarsi. So it's quite a sensitive structure that almost looks continuous with the anterior talofibular ligament here. The function of this is to prevent adduction of the calcaneus. And then over here we've got the lateral talocalcaneal ligament passing from the lateral tubercle on the talus across the lateral aspects of the calcaneum. Both of these prevent adduction of the calcaneus. The mid-tarsal joint is the other joint that contributes to the movements of inversion and eversion, and this is the mid-tarsal joint, this purple line that we can see going between talus and calcaneus at the back and navicular and cuboid at the front. Functionally it behaves as one joint, but anatomically it's two joints. We've got the talocalcaneo-navicular joint over here, and on the lateral side we've got the calcaneo-cuboid joint. So it's a composite joint. It's made up of two anatomical joints that have the separate joint cavities, but functionally it behaves as one. Now the talocalcaneo-navicular joint is a ball and socket joint. It's a synovial modified ball and socket joint. The ball being formed by the rounded head of the talus, and the rounded head of the talus then slots into a socket formed by the posterior aspect of navicular, the superior aspect of the calcaneum, and the spring ligament. These three structures together form a concavity which receives the head of the talus. So it's your typical ball and socket joint. The spring ligament is also called the plantar calcaneo-navicular ligament. The superior surface of this structure is covered in fibrocartilage, but all the bony components are covered in hyaline cartilage. It has a simple capsule passing from one articular margin across to the other, and just like any other synovial joint, the capsule is lined with a synovial membrane that secretes synovial fluid. Laterally, we have the lateral part of the mid-tarsal joint, which is the calcaneo-cuboid joint. This is classified as a synovial saddle joint, but behaves very much like a synovial plane joint. The main movement occurring between these two articular surfaces tends to be an upward and downward glide during the movements of inversion and eversion. These are very simply between the posterior aspect of cuboid and the anterior aspect of the calcaneus. It's a very mobile joint. Articular surfaces are all covered in hyaline cartilage, and the whole thing is surrounded by a capsule which in turn is lined with synovial membrane. The ligaments of the mid-tarsal joint are fairly complex. We have two dorsal ligaments. This one here, which goes from the dorsum of the head and neck of the talus over to the dorsum of the navicular. This is called the dorsal talonavicular ligament, and over here we've got a small structure called the bifurcate ligament. It's called the bifurcate ligament because it splits into two, it bifurcates, and it's got two components to it, two arms to it. One branch, and again clinically probably the more important of the two branches, is the branch that goes from calcaneus to the dorsum of cuboid, and the one that's less commonly injured is the one that goes from the dorsum of the calcaneum across to navicular. This one here, the calcaneo-cuboid branch, is continuous with the cervical ligament of the mid-tarsal joint, which in turn appears continuous with the anterior talofibular ligament. Both of these structures limit the movements of plantar flexion, and the lateral components will limit the rotation into inversion, whereas the medial components will tend to limit the movements of eversion. On the plantar aspect, we've got three very strong ligaments. The spring ligament that we've mentioned already, called the plantar calcaneo-navicular ligament, going from the underside of the sustentaculum tali, as we can see here, across the length of the navicular. And the function of this spring ligament is to hold the head of the talus up. Lateral to that, we've got the short plantar ligament, which goes from calcaneus along to cuboid. So this is sometimes called the plantar calcaneo-cuboid ligament, passing from the anterior tubercle here across the length of cuboid. And then covering the short plantar ligament, we have the long plantar ligament, which passes from the posterior aspect of the calcaneus here, distally blending into the bases, the plantar aspect of the bases of the four lateral metatarsals. The movements of inversion and eversion are complex movements. So the physiological movement of inversion is made up of adduction occurring at the subtalar joint and supination, anatomical supination, occurring at the midtarsal joint. The movement of eversion is abduction at the subtalar joint and pronation occurring at the midtarsal joint. The movements of calcaneal abduction are therefore accessory movements because they cannot be produced in isolation by primary muscle action, as are the movements of supination and pronation. But what we do clinically is we can test these components of inversion and eversion separately to help us localize our treatment far more effectively. Surface anatomy of these structures can be looked at in detail, or can be found in detail in this text, which is Anatomy, Palpation and Surface Markings by Derek Field.